welcome to our city. It's a great place to be. And it's really a pleasure for me to have an opportunity to welcome all of you to this conference that's going to focus on using technology in healthy aging. I thought I'd start my remarks and tell you a little bit about the office I lead, the Office of Disease Prevention and Health Promotion, what we do and some of the products within our office. Our mission is pretty simple, that we're trying to lead the nation towards a more, for better health for all citizens within this nation. And we're doing that by a number of mechanisms. We develop policy and guidance for the American people. We bring together public health experts to try to mobilize support for these efforts. We're responsible for coordinating all the activities across HHS that deal with prevention, from CDC to NIH to HRSA to CMS, etc., and to make sure that all the health education and the preventive programs dovetail nicely with one another and support a common goal. And then the last thing that we try to do out of our office is support those very valuable public-private partnerships that move prevention to the forefront of what we are thinking. As Colin mentioned, and I don't know if any of you other than Colin had the opportunity to attend, my office sponsored the first ever Healthy Aging Summit supported by the Department of Health and Human Services about a year ago. I think we felt it was a great success. Over 700 people that included healthcare professionals, the public health community, some senior citizens themselves, academia, federal officials, etc. The summit was really a state of the science summit. What is it that we know about healthy aging? What is it that we don't know? What do we need to do moving forward to improve this important area? We looked at policy, we looked at research, and we looked at care for older Americans. And we did it through the lens of multi-sectorial, including the public health community, the healthcare delivery community. We looked at what academia had to say about healthy aging. We brought in individuals from the Department of Transportation, because we know that's a very key element for healthy aging, as well as the housing sector. And then the very important issue of the built environment and environmental planning and what can be done in that area to ensure healthy aging. We had participants that were truly experts in all those domains that I just mentioned that came together to share what they knew would help promote a more healthful aging community. It was a two-day conference that was well attended, as I mentioned, but it was followed by a one-day conference in which we brought the state health officers from the 50 states across the United States and the state aging officials from the 50 states, brought them together for additional dialogue. It was co-sponsored by the Association of State and Territorial Health Organizations, or ASTHO, and NASHWAT, which is the aging community. The purpose of the conference was to, first of all, discuss what they had learned from the many experts that were there, and then to begin to set some priorities for their states and their regions that they could take back to their states and begin to implement. I thought you might be interested that the large body of issues that were discussed, what rose to the top? What were those top priorities at the state level that the state policymakers wanted to focus on? And there were a number of that. I think fall prevention was a key area for most everyone. Injury and violence prevention was very important. We spent a great deal of our time on mental health and cognitive decline, obviously a very important issue moving forward. Some of the bread and butter public health issues like tobacco cessation, physical activity, nutrition and weight status, all those were important to this group. And there was also a priority on caregiver support, and certainly those of you that work in this area know the importance of caregiver support. I think one of the things that surprised all of us were some of the emerging issues, emerging priorities that this group began to identify. They felt that volunteerism was a very important issue that they wanted to focus on as it related to healthy aging. Occupational safety, more and more seniors are staying in the workplace for a longer period of time, and bring special challenges to the occupational safety community. Food insecurity is a key area, a key problem among this particular population, medication assistance, and domestic abuse. At the end of the conference, we felt that these states had identified some priorities, and we sent them back to their states and to their regions to go back to work. Quite frankly, we hope what we did with the State of the Science Conference followed by the State Officials Conference is the first of many activities that we'll do on a periodic basis to try to promote healthy aging, not only here in Washington, but at the state and community level, which is where rubber meets the road in the public health community. I'm very pleased to report that we got a report back from the states about a month ago, and we could begin to see that some of those ideas that were brought to the forefront in the Healthy Aging Conference were now being implemented at the state and local level, and that will continue with time. I became very interested in the healthy aging issue when I joined this office, or was asked to lead this office 4 years ago, primarily from the demographics. Our baby boomers are going into their senior years, and we are having more and more individuals in the senior population, as all of you know, and I think that you're going to see more and more, certainly at the federal level, around healthy aging. I think the Healthy Aging Summit was first of all inspiring because of all the new ideas and new thoughts and research and treatment and prevention that were presented by the experts there. But it was also motivating for a variety of reasons, mainly around the challenges of bringing disparate communities together to solve common problems, be it the housing, with the transportation, and other groups. I think one of the key takeaways from our conference around healthy aging is that prevention is going to be key. That we're going to need to focus as much as we can on prevention so that people can age well and prevent some of those chronic diseases that we know affect the quality of life for all of our senior citizens. I have to tell you that prevention, as the name of my office is at the core of what we do in the Office of Disease Prevention and Health Promotion. And we often look at prevention through 3 different lenses, the first being at the individual level, and what is it that the individual needs to do in the area of prevention. And these go back to those lifestyle changes that are so important, physical activity and making sure you get your weekly 150 minutes of physical activity, the healthy eating that is so important, and then being engaged in the healthcare decisions and the preventive clinical services that are so important. My office partners with the U.S. Department of Agriculture every 5 years and comes out with the dietary guidelines for Americans. You probably recognize what was the pyramid in the past, and now it's the My Plate symbol that's on many of the cereal boxes and that you see everywhere. That's a product out of our office and kind of outlines for the American people what a healthy diet looks like. We just released the 2015 guidelines in the last 2 or 3 months, and they will come out again in 5 years from now. We're beginning now to work on an update to the physical activity guidelines. They came out for the first time in 2008, and they attempted to quantify for Americans the amount of physical activity that they needed to get each and every week that were associated with the positive health outcomes that we know are associated with physical activity, which is 150 minutes a week of moderate exercise, or 70 to 75 minutes of vigorous exercise every week. We're now in the process of updating those. We're having an advisory committee, and we'll be moving that issue forward as well. So at the individual level, we think that there's a key element for prevention and encouraging Americans to make those positive lifestyle changes that we know will prevent chronic disease. Secondarily, we look at prevention at the population level and what happens at the population level that affects prevention activities. And it's mainly through the social determinant of health lens that we look at population health and prevention. Do individuals have access to the health care that they need to obtain the clinical preventive services, et cetera? If you look at certainly prevention and public health in general, the social determinants of health are front and center of what we are doing here in Washington and really what's happening across the globe. Carter Blakey, who's my deputy and leads the Healthy People Initiative, has a topic area just on the social determinants of health and approach to that. And I'll say thirdly, we look at the issue of prevention through the lens of, or through the perspective of the health professionals who are really responsible for keeping patients healthy. Our office works around the issue of trying to prevent healthcare associated infections for those individuals that that are patients in hospitals, and also prevent adverse drug events. Obviously, knowing this audience, as Colin kind of educated me of your interest in the focus of this, you may want to know, well, where do we see the intersection of what we do in prevention and technology? And I think it's a disconnect for many people. You don't think that there's a strong tie-in between technology and public health, but I tell you that there actually is. I think prevention has long been thought of kind of the boots on the ground, what we need to do to eradicate smallpox from the globe or other issues like that. But as we move into this highly technological area, prevention is playing more and more, technology is playing more and more an important role in prevention. And clearly, for us to make success in moving the public health needle, we need to take advantage of every tool at our disposal, and that includes technology. I think the primary way that we use technology to address prevention issues is through the advancing of the evidence base. Everything that we do in the form of policy here in Washington has to have an evidence base behind it. That there has to be some evidence-based research or data to show that what we're proposing actually is successful in some arenas. With so many advances in understanding about the role of prevention in health, we must ensure that the most current evidence base is actually at the forefront of any new policy that we actually put forward. I think that another way that we see the intersection between prevention and technology is something that probably all of you have in your pocket right now, which is your cell phone. And the number of apps that are now available that can ensure that individuals use those apps to make those healthy lifestyle changes. You can track your physical fitness and the amount of activity you have. You can track what you actually eat each and every day. So technology will play a key role and continue to play a key role at the individual level in promoting prevention. We also think that there's an opportunity for those of us in government to provide technology tools for the advancement of prevention. And I'll tell you about a special project, a collaboration between our office and actually CDS that took off within the last year. CDS is actually using one of our apps in which consumers at their minute clinic or within their pharmacy can, from their website, go in and put their age and their sex and push a button and immediately know what clinical preventive services they should be taking advantage of. It's time for your flu shot. You need a pneumococcal vaccine. You need a mammogram, etc. They actually did an evaluation component of that and found that including this app on their website markedly increased the uptake of some of the clinical preventive services, in particular pneumococcal vaccine, among those individuals that visited their site. So there's an opportunity, again, as it relates to apps to ensure that patients are educated and make wise decisions. And lastly, we consider the opportunities for advancement in technology to address the social determinants of health by improving the environment in which Americans live. For example, innovations in healthcare delivery, especially in some of the rural areas, what we're seeing with telemedicine and the opportunity to connect healthcare providers with patients in need in some of these rural environments through telemedicine is really revolutionizing that sector. I think if you look at the data around healthy aging, we all recognize that social interaction is one of the keys. It's just paramount to keeping people healthy and active, and even in some regards preventing cognitive decline. And certainly as technology advances, the opportunities to connect individuals one to another without the face-to-face encounter is increasing. And so that would be another area, opportunity for us to use technology as we improve the health of our senior citizens. So those are just a few of the ways that ODPHP considers and really incorporates technology in our prevention efforts. And I know that that will only increase as we move forward. Frankly, as Carter and I had an opportunity to look at your agenda, we were excited and look forward actually to learning from each and every one of you. Unfortunately, I got called back to a meeting with the Assistant Secretary, so I'm only going to be able to stay for an hour or two, but Carter will be here a little longer than that, and we look forward to the dialogue and learning from you about what you see as the intersection between technology and healthy aging.